Hello, USM. Ladies and gentlemen, thank you very much for this opportunity to help us work together as part of USM student community. We are a team of six, Ammar, Mohammed, Nurul, Owi, Taimur, and Young. So SDG 5, gender equality, is well observed here actually. We are proud to be part of the USM, and we are grateful to give us this opportunity to pursue our postgraduate education in our various fields. Actually, it is interesting to know that USM's support to SDGs is well proven through hosting the second international conference on sustainable development goals in 2019. So pushing this forward, we believe that this assignment is part of that those efforts of USM to serve and to raise the awareness about SDGs. So SDGs actually, we have, when we go into slide 3, the SDGs are 17 goals. They involve, they are a course of life. They take care of society, of the environment, of everything in the air, on the ground, and under the ground. 17 goals, 169 targets, 230 indicators. In September 2015, they were formally adopted by the UN, and in January 2016, the SDGs became applicable and relevant to UN member states. The deadline for the full implementation of these SDGs is 2030. So the objectives are broad, integrated, and cover a wide range of social, economic, environmental, and other issues actually to have a better life and peaceful societies. What we have chosen in our presentation is SDG 3. Which is to ensure healthy lives and promote well-being for all at all ages. This is actually, the word health here emphasizes the use of social and personal resources as well as physical capabilities for the service of health and well-being. Health is fundamental to human development. All people and all social status consistently put good health as a top priority, and healthy people are critical to sustainable society. And actually, Biskov in 2019 talked about the development of a systematic contemporary health system that is like a global health strategy to achieve this sustainable development goal. So healthy communities play their roles in maintaining and improving health as well. Then we have, when we have SDG 3, we have several concepts and values and principles that are at play actually. When we talk about health, we talk about social justice. We have health equity served, intergenerational equity, gender equity are also served. We talk here about human rights. It is a life course approach with social arrangements and institutions and policies that should play all their part in maintaining health and raising the awareness about health and well-being in the society. It is a way to improve the conditions of daily life. So we will have empowerment, we will have social gradients in health, and mutual responsibility of all members of the society towards each other. We present the example of Malaysia's efforts towards SDG that are well proven through its 11th development plan, 5-year plan of 2015-2020. It is put in under pillar, it has been mapped to pillar 2, enhancing inclusive development and well-being in that plan, and also mapped into focus area A, achieving universal access to quality healthcare, and focus area D, improving road safety and emergency services to reduce fatalities, and focus area F, promoting sports for healthy living and unity. So you see, Malaysia has taken this SDG in its full spectrum. In the next slide, slide number 7, we have the working ages health and well-being. It is a life course approach to tackling inequalities in health, adapted from the WHO European review of social determinants of health and the health divide. You see, we have the macro level context, we have the wider society and the systems that all play together towards the life course stages and better health service delivery to all members of society. And then we see that we have the prenatal, the early years, the working ages, and the older ages. These are all taken into consideration in this SDG. We move into employment. You know, it is one part of those 4 or 5 categories. The employment and their working conditions, the employees and their working conditions have powerful effects on health and health equity. Here, we will, of course, when these are in good conditions, we will have a paid holiday, financial security, we will have social protection benefits, personal development, social relations well served, and self-esteem and protection from physical and psychological hazards. So, how we can conceptualize this well-being into employment? We can have questionnaires. We can be in a better position to help the government to measure the objective and subjective dimensions of an individual's sense or awareness about their well-being. In this case, we are talking about employees in their work conditions. So we have the life experience of an individual that can be measured through the satisfaction with life scale questionnaire, SWLS, and through the emotional experience that can be measured through the scale of positive and negative experience, SPANE. These two are introduced by Dainer in the year 2000. These, when they are distributed, and these are like there will be the conceptualization of the SDG 3, when they are distributed to the public before and after their experience with the health service in Malaysia, they will put the government into a better condition to benefit from these data that will be taken from the questionnaires, and it will achieve progress of Malaysia towards a full achievement of SDG 3. So in slide 10, we see the sample questionnaires and the type of questions that could be put into these 2 questionnaires, the SWLS and the SPNE, and we see that they have a number of items through which we can know about the individual's feeling, negative or positive, about where they are, and how the way they see that the health services are presented to them or not presented, maybe. Are they satisfied? Are they unsatisfied? So with which do they agree, with which they disagree? These questionnaires are very important to be introduced in our work, so that we will better know about the individuals themselves and what they miss, and also how we can improve SDG 3 in Malaysia. And then, of course, we have the references. Thank you very much for listening, and please forgive me for going fast because we have only 10 minutes. Thank you again, USM, for this valuable opportunity actually for us to work as a team.